Joining me today is Dr. Megan Manthe, one of the newest members to the Jacksonville Orthopedic Institute team. Thanks for being here.
Yeah, thanks for having me.
So you grew up in Minnesota, huh? It's kind of cold up there.
Oh, it's freezing up there, but we do have beautiful summers, and that's what we all say.
Well, did you always know that you wanted to pursue a career in medicine?
Always, yeah. I knew probably since elementary school that I wanted to be a doctor of some sort. I didn't know until med school, actually, that I wanted to be an orthopedic surgeon, but medicine was always in the cards for me.
Well, you were an athlete growing up. A couple of different sports. What did you play in high school?
Yeah, yep. So in high school, I did cross country in the fall, basketball in the winter, and then track in the spring. So and track was my main sport.
And you had an opportunity then to move on and run track in college, a Division I school?
I did, yep. So I got a scholarship to run at University of Kansas, and I was there for 4 years for undergrad, and it was great. Traveled all over running races, and it was a good experience.
Where'd you become a basketball fan?
I mean, I was a basketball fan before, but it's hard not to love it when you're a Jayhawk. Yeah, we had a lot. Even when I was there, we had great teams and fun to follow. So.
Well, I'm sure that place is crazy.
Oh, the games are amazing. The games are amazing. People camp out for a week before the game to get in, but a lot of the athletes we kind of snuck in.
Well, hey, you guys got a free pass, right?
More or less. It was an easier pass.
Well, you went to medical school there.
Yeah, medical school in Kansas City.
How do you wind up in Florida?
So yeah, in Florida, I mean, kind of random. You know, once you figure out what you want to do, you throw out your applications all over the country, and then certain places interview you. You see what you like, and then you make a rank list, and that's how I got here.
Well, I'm sure that you're enjoying the weather. I mean, Kansas can probably have some cool weather. Of course, Minnesota certainly can.
Yeah, Minnesota's snow, Kansas is ice storms, and Florida's just pleasant all the time. So it's much warmer, and I love it.
Well, are you still active? You still
Yeah.
You still get out and do some running?
I do. I still run. My distance is a little bit longer than what I did in college. College I was a miler, and now I do 5Ks, half marathons. I've done a couple marathons too. So
what kind of times you running?
Right.
Per mile?
Per mile, usually, I mean, for my longer races, I'm going about between 7 and 7:15 or so.
Yeah, that's running. So we were talking earlier, so I have to say this. I interviewed Dr. Freiberg. You said that you finished before him in the gate run.
Gate run, Freiberg's no competition. I got him beat.
Well, if he sees this, he should have some extra motivation.
I hope he does.
Yeah. Another talented young doctor, part of the Jacksonville Orthopedic Institute team. So, well, since you've been here, I know you love sports. Tell me, who's your favorite college football team?
College football, so again, I went to Kansas for undergrad. I followed them for basketball, but for football, I actually follow the University of Michigan. So I'm a Wolverine fan for football.
I'm kind of trying to figure out how that happened.
Again, I grew up in Minnesota, but my extended family all grew up in Michigan. Most of them went to University of Michigan. I even looked at Michigan when I was being recruited.
So did you watch that game last week? Everybody's talked about that. Maybe one of the most just bizarre plays in the history of college football.
I mean, it was memorable. I mean, some people, if you read all the Michigan blogs, some people are trying to blame Harbaugh and that he shouldn't have called for the punt. But, I mean, that's a fluke. It's a fluke happening. Yes, it costed us the game. I don't blame anyone because it doesn't happen very often. I mean, if you look at the three previous games, nobody scored on us.
Right.
So, they're still a fun team to follow. I'd like to forget that game, though.
Well, I'm sure that he'll have them competing.
Yeah.
For sure.
No, he's gonna be a great coach for them. I'm excited for him.
So, what's your area of expertise? What do you say specialize in? Would you say?
So I specialize in hip and knee replacement. Anywhere from the primary joint, so when you first get the knee replacement, to if and when things go wrong, if you need revisions and things like that.
And I guess are any particular? I mean, you could probably have knee problems at any age, but that's probably maybe older? Yeah,
typically for a hip and knee replacement, you want to kind of delay it as long as you can. I don't want patients limiting their life activities and their quality of life to decrease to wait for a knee. But on average, our patients are mostly elderly, 50, 60, 70 years old or so.
And so what's the time frame like for that? Let's just say I decide I need to have my knee replaced. Take me through that process.
Yeah, well, there's certainly non-operative measures that we try first. We try the safe things first. Those are over-the-counter anti-inflammatory medications. Injections can provide temporary relief. Sometimes physical therapy, staying a healthy weight. There's a lot of things that you do early on before surgery. Once all of those fail, then we talk about surgery. We talk about expected recovery and getting back to life.
So what is that time frame like?
Most patients, you know, it requires a lot of physical therapy for about 6 to 8 weeks. On average, most patients are back to their normal life, their activities that they like by 3 months.
Wow.
I do say the full recovery as far as muscle strength and stamina, though, takes 12 months.
Is there anything that if somebody's watching this, that if they're having some kind of issue, what's something they should be looking for and, hey, I need to go get this checked out?
Yeah, so if it's a new pain that's not getting better with kind of just the RICE protocol, so resting and icing
Right.
and elevation, and you know, so if it's a new pain that's not getting better, or if it's a kind of a chronic pain that you've had for years, but you're noticing that, hey, I can't walk for exercise anymore, I no longer can play doubles tennis, or you know, I can make it 9 holes on the golf course, but I can't make it 18 anymore.
Right.
You know, those are, you know, kind of quality of life factors, and it's worth it to get it looked at.
Well, that sounds great. Listen, we appreciate you being here today. Of course, if you've got any knee or hip problems, you certainly want to get out here and talk to Dr. Megan Manthe. And
Yep.
Look forward to talking with you again. I'm sure you'll be, you know, doing some more marathons and staying active.
Yeah, absolutely.
Thanks for being here.
Thank you.